Hi, my name is Dr. Sunil Sharma. I'm the Director for New Life Surgical Associates, Jacksonville, Florida. In this video, I will try to explain abdominal hernia, particularly robotic repair of hernia. People often ask, what is hernia? A hernia is a defect in your abdominal wall. The innermost lining, we call it fascia. And through this abdominal defect, the content of the abdominal cavity comes out. It may be omentum, fat, or organ. That is abdominal hernia. Usually, the patient will feel a lump or a swelling. It may be in the groin, we call it inguinal hernia. It may be around the belly button, we call it umbilical hernia. Or maybe through previous incision, we call it incisional hernia. Irrespective where the location, the treatment is same. The hernia, once it has developed, it's progressive. It's a defect in the anatomy and has to be corrected. Traditionally, we used to do an open operation where a big incision is placed. You cut the skin, fat, muscle, reach the fascia, identify the structure which is coming out, push it back, close the fascia, then you put a mesh because tissues are weak. Close the muscle, fat, and skin. Recently, they started doing laparoscopic, in which you put the camera and the small incision instruments from the side. You visualize from the abdominal cavity the structures which are going through. You pull these structures down, identify the defect, and put a mesh underneath. So the difference is, in open operation, you're putting the mesh above the defect, and in laparoscopy, you're putting it underneath. It's like a flat tire. You want to put a patch inside the tire, so the pressure will keep the patch in place. For last 4 years, I have switched my practice from laparoscopic to robotic hernia, and there are obvious advantages to it. The biggest advantage of doing robotic is, after putting the camera and 2 instruments inside, I can reduce the defect easily, and I can actually close the defect with the stitches, which was not possible using the laparoscopy. Then I can place an adequate size mesh, and I can stitch it all around it so it doesn't move. It's much less painful. There is hardly any bleeding, and the recovery is much faster. So if you have any of these symptoms related to hernia, or you want to get it examined or needs a hernia repair, please call my office 904-399-4004. Visit my website for further information, make an appointment, and I'll be happy to help you. Thank you.